I am Dr. Rupak Singla. I am head of the Department of TB and Chest Diseases at the National Institute of TB and Respiratory Diseases, New Delhi. I have been working here for last 33 years and seeing all kind of cases of tuberculosis, MDR-TB, XDR-TB and other chest diseases. I am also assisting the Govt of India for framing and revising the national guidelines for MDR, XDR-TB, HIV-TB, pediatric TB and other forms of tuberculosis. Today we will be talking about the drug-resistant TB. What is drug-resistant TB? You see, normally when somebody has tuberculosis, he or she responds to the commonly used anti-TB medication, and it is said to be that person is suffering from drug-sensitive tuberculosis. However, due to various reasons, we will talk about them a little later, the bacteria of the patient, they become resistant to the commonly used anti-TB drugs. We call them first-line medication. In this scenario, it is said that this person has got drug-resistant TB because he is not responding to the commonly used first-line drugs for the management of drug-sensitive TB. How does one develop drug-resistant TB? You see, there are various reasons for the drug-resistant TB development. We also call it a man-made problem. The reason being the commonest cause of development of drug-resistant TB is that the patient takes the drugs irregularly in inappropriate dosages or stop taking the drugs prematurely. And why? Because sometimes they feel better, that now they are feeling good, so why shouldn't they take the drugs? So sometimes because of the side effects. And sometimes they take the drugs, stop the drugs, then again take the drugs. So all this can lead to the development of drug resistance. Another reason is sometimes out of ignorance or lack of knowledge, the doctors prescribe the drug treatment for the tuberculosis in inadequate dosages, or the number of drugs which are given are less, or they give for a lesser duration for which it should have been given. And in one of the studies which is published, they collected the prescription of the doctors for tuberculosis and drug-resistant TB, and they found that almost around 100 different type of prescription was there. So you can imagine that different type of prescriptions are there, although from the Govt of India, there are only 3 or 4 types of the standardized medicine for the TB. Another reason is that some of the patients are not absorbing these drugs. They take the medicine, but in the body, it does not go to the blood, does not reach the lungs. So that is another reason that they have. Then another reason could be that there is a poor quality of the drugs which patients are consuming. The drugs of poor quality, it has lesser medicine than it should have, or if the quality is so poor that it does not affect the killing of the bacteria. Then there is something called primary drug resistance. You know, the drug resistance TB patients, they are spreading the infection to all around to the other patients. If some person gets the infection from such a patient who already has drug resistance, then it is called primary drug resistance. So here also one can develop drug resistance from the beginning of the treatment. How one should diagnose, or one can diagnose drug resistance TB? You see, it's a laboratory diagnosis. You have to take the help of a laboratory. So there are various ways. One way is that you grow the bacteria in the laboratory and subject it to the drugs. In case the bacteria are inhibited, we call it drug sensitive. If bacteria, they still grow even in the presence of drug, we call it drug resistant TB. But this method, which is also called phenotypic method, it takes long time. It could be 4 weeks, 6 weeks, 8 weeks, sometimes even 3 months. Now there are newer methods which are called genotypic methods, which are molecular based method. And here the time taken is say 1 day or 2 days only. Here within 1 or 2 days you can diagnose that somebody is having drug-resistant TB. What are the common types of drug-resistant TB? You see, there are 3-4 types of drug-resistant TB. There are drugs called first-line drugs. Then there are drugs called second-line drugs. Second-line drugs are used when the first-line drugs, they fail, person has resistance, then we use the second-line drugs. So among the first-line drugs, 2 most commonly and most effective drugs are isoniazid and rifampicin. In case somebody develops resistance to both of these drugs, that is INH and rifampicin, it is called multi-drug resistance TB. And in case somebody is resistant to only one drug, that is isoniazid, it is called the H monopoly drug resistance TB. Then third form is if somebody has on top of MDR resistance to the other second-line drugs also. Second-line drugs are used to treat the MDR-TB drugs. So in case somebody has resistance to MDR-TB drugs also, so in addition to the MDR-TB drugs, the second-line drugs are also resistant. It is called the XDR, that is extensive drug resistance TB. We need to know that H monopoly drug resistance TB is a simpler form and it can be treated in 6 months time. The MDR TB, that is multi-drug resistance TB, it requires treatment for, there are two kinds of treatments. One is for 9 to 11 months and second is for 18 months to 20 months. And which one to choose depends on what type of drug resistance patient is having, how much is the involvement of the lung and several other factors. And then we have this XDR TB treatment, that is extensive drug resistance TB treatment. Here we have to give for 18 months to 20 months. So now there are researches going on across the globe and they are looking for medicines which are to be given only for 6 months or 9 months. But in our country, as of now, as per the current national guidelines, we need to give the period for which I have already informed you. This shorter, the MDR-TB treatment is still to be for 6 months or 9 months, still to be adopted by our government. Is drug resistance TB curable? If you expect answer in one word, yes, it is curable. But first thing which I would like to emphasize is that it is preventable. As we said, in case patient take the drugs irregularly or stop it prematurely when they are having drug-sensitive TB, then they are likely to go for drug resistance TB. So we must ensure, patient should ensure, the health system should ensure that patient take the drug regularly, full duration and for adequate time, for full and in proper dosages, so that drug resistance TB does not develop. Then in case unfortunately still patient develop drug resistance TB, then there are drugs as we discussed earlier. So patient should take these drugs for full duration regularly and the dosages which have been prescribed by the doctors. And fortunately these drugs are available, the drugs for the drug resistance TB are available free of cost in many centers across the country. They are available in the urban area, they are available in the rural area, they are also available in the hilly areas and totally free of cost. At different places, these centers have been opened by the Govt of India where patient can go, get themselves diagnosed free of cost and get themselves treated. Only issue with these medicines are that they have to be taken for longer periods, either for 9 to 12 months or 18 to 20 months. They are expensive, but because they are available free of cost, that should not be a matter. And another big issue is that they have a lot of side effects. Most of these second-line drugs which are used for drug resistance TB, they have a lot of side effects. So the moment patient has side effect, he should report to the system, health system, and there the doctors and the nurses who are there, they should diagnose early and take care of the patient so that he or she does not stop the treatment early. What is my message to the patient? The first message is please prevent the development of drug resistance TB when you are at the stage of drug sensitive TB. Take the drugs, whatever has been prescribed to you regularly in proper dosages for the full duration so that you don't develop drug resistance TB. If still you have drug resistance TB, you go to the nearby center, TB, the DOT center, and you will be given the medicines. You take them for full duration. In case you have any issue, any side effect, please discuss them with the doctors and the nurses of the center. They will help you, but do not stop the treatment prematurely. So it is fully curable provided you help yourself. So patients have to help themselves if they want to be cured of the drug resistance TB. Thank you.